Causes of frequent urination. This is for both men and women, okay? Most people believe that the moment they see themselves urinating frequently, their mind goes to diabetes. No, it is not just diabetes that can make you to urinate frequently. There are other conditions, there are other things that can actually make you urinate frequently. Frequent urination is when you are urinating more than usual, okay? You can go urinating 8 to 10 times in a day, and there are causes to this. Number one is urinary tract infection. As a man or a woman, if you have urinary tract infection, you will be urinating frequently, okay? Number two is excess fluid consumption. Yes, if you're taking a lot of water, of course, you always urinate, okay? It will make you to be visiting the restroom often because you're taking a lot of water, and that is normal. It is not a problem, okay? Number two is prostate enlargement. This is usually for men, that their prostate is enlarged, okay? So this will make them to be urinating frequently. It can be coming in a little quantity, but you just see them going to the restroom frequently to urinate. Another one is pregnancy for women. A woman who is pregnant can be urinating frequently this is due to the growing baby applying pressure on the bladder. Also, she'll be going to the restroom often to ease herself. So another one is some neurological condition, like if you have a spinal cord injury or stroke, it can put one at the risk of urinating frequently, or there is a tumor growing in your brain, it can put you at the risk of urinating frequently as well. So we have another one that we call, it can be infection, like infection to the urethra or to the bladder itself, to the even the vagina. So if you have infection in that area or bladder cancer, it can put you also at the risk of urinating frequently. We also have high blood sugar, that is diabetes. If you're diabetic, you will be urinating frequently. You see yourself going to the convenience to urinate frequently. That urge will always come because there is pressure in your kidneys, okay, trying to excrete the excess fluid that this high blood sugar has accumulated in your body. So that frequent urination will also be there. So another one is menopause. Women that have reached their menopause due to the absence of estrogen. So it is going to affect the lining of their bladder and also their urethra, and this will put them at the risk of urinating frequently. So another one is medication on some certain substances, okay, like excess consumption of alcohol and caffeine can put you at the risk of urinating frequently. Also have childbirth, okay, a woman who has given birth, this can make her pelvic floor muscles to be weakened, and this will amount to frequent urination. All right, obesity as well can put someone at the risk of urinating frequently. So if you find yourself urinating frequently, what you should do, you should go to if you know you are not consuming excess fluid, okay, and you are not consuming excess alcohol, and you're not taking caffeine, you just notice you're urinating frequently, I would advise you go to the hospital to see a doctor. They will examine you, carry out some series of investigation for them to actually find out what is making you urinate frequently. Okay, if it is as a result of the weakened pelvic floor muscle, like in the case of a woman who has liver, you can begin your Kegel exercise. Okay, it will help to bring those pelvic floor muscles together and reduce the frequent urination. If it is excess fluid, you can modify your fluid, okay? Modify the amount of fluid you take in a day. If you think that the frequent urination is consigned to you, you can just reduce the amount of fluid you consume in a day. If it is alcohol, you take off, you drop the alcohol consumption, and if it is caffeine, you can limit the intake as well. So guys, bye for now. Don't forget to share. See you in my next video.